On October 11th, public interest law firm ABC for Health released a new report called Medical Debt and Collections in Wisconsin, Restarting the Collections Machine. The report examines medical debt lawsuits filed before and during the COVID pandemic in the state of Wisconsin. A key finding was that some Wisconsin hospitals and specialty providers have resumed aggressive collections actions lawsuits after a pause during the COVID pandemic. The report also gives some suggestions for improvement, including how to build equity and transparency in some hospital financial assistance policies and practices. Here are some key findings from that report. 19 of the 29 providers studied had restarted collections actions after stopping during the pandemic. 15 filed suits at a higher rate than they did pre-pandemic, and 2 more providers were trending in that direction. 29 providers combined to file over 400 lawsuits in just January of 2022. New lawsuits were filed mostly by smaller providers, such as physician groups, clinics, and small hospitals. A lot of the larger hospital systems did not appear to have resumed lawsuits, and there were a few exceptions to that. Now, ABC's previous research showed that over 99% of patients are not represented in these lawsuits. Over 95% of the judgments were default judgments, pointing to some equity issues and how the playing field is just not level for patients being sued for medical debt. And again, the report says the pandemic's not even over yet. The effects are still being felt by many families across the state. In a statement, ABC for Health's director Bobby Peterson said these providers should focus on helping patients connect to health coverage options instead of reflexively dragging them through the collections machine. Now, the report also gave some recommendations for improvement. In one area was with the financial assistance policies and practices of many of the hospitals. They said, try to improve transparency and equity in a couple of ways. You can remove financial assistance deadlines and geographical limitations. You can improve training for financial assistance staff. You can present clear eligibility criteria. You can make applications accessible and flexible, and don't send patient bills to collections while you're still processing their financial assistance application. There were broader recommendations as well that looked at being more proactive as hospitals instead of reactive. The report says hospitals should help patients obtain and maintain health care coverage rather than focusing on collecting uncovered bills. They also say training and continuing education for many hospital staff would be appropriate. And also remove the middleman of the collection agency. ABC for Health says their work is not done. They're going to continue to research and study the inequities in medical debt, identify solutions, work directly with patients, and conduct community education on patient rights and responsibilities. You can read the full report. We link to it in the description below.